this video, the Center for E-Learning Didactics and Educational Research at the University of Veterinary Medicine Hannover will present how to place a urinary catheter in female dogs via manual palpation. Only one of the correct methods to perform this skill will be shown here. Within veterinary medicine, urine is required for a variety of diagnostic tests. This can be obtained through a multitude of methods. Among these would be the collection of spontaneous urine, the use of a urethral catheter, or by sampling via cystocentesis. If a sterile sample is required, the optimal methods are either a urethral catheter or ultrasound-guided cystocentesis. With female dogs, the anatomical positioning of the urinary meatus results not only in a more complex catheterization than with male dogs, but also increases the likelihood of bacterial contamination. If a microbiological test is to be done, then acquiring urine via cystocentesis remains the gold standard. Indication for the placing of a urinary catheter would be the need to acquire urine from a very empty bladder, emptying the bladder completely pre-operation or with disrupted innervation, or to inject a contrast medium for a retrograde urethro and cystography. Needed for the Skills Lab exercise are sterile gloves, a sterile container for collecting the urine, chlorhexidine or hypochlorous acid, or an iodine solution, a sterile urethral catheter, either a rigid variant or a Foley catheter, a kidney dish, sterile swabs, and with living animals also a shearing machine. First, all required materials are prepared. An assistant fixates the standing patient. A sedation can be required. The vulva is cleansed with a dry, sterile swab. Both the inside and outside of the labia is scrubbed and disinfected with a chlorhexidine or hypochlorous acid solution. The surrounding region can be rinsed in the same way. First, we will demonstrate how to properly utilize a rigid catheter. If catheterization is being performed alone, then the catheter packaging should be opened and prepared beforehand, in such a way that contamination is avoided and a sterile removal is possible. After this, wash and disinfect your hands hygienically and apply sterile gloves. The rigid catheter is removed from its packaging and fixated with the inserting hand. It is critical that the catheter and gloves are not contaminated in the following steps. For this, the end of the catheter lies under and slightly caudal to the fingertip. Both index finger and catheter are together inserted into the vestibulum vaginae. Slight pressure on its floor aids in sliding the finger cranially until the papilla urethralis can be felt as a slit atop a small mucosa mound. The urinary meatus lies medially between many mucosal folds. If resistance can be felt, then it is possible that the catheter has found itself in such a fold or is in front of the cervix uteri. In such a situation, the catheter is carefully retracted slightly and the direction is corrected. Under further digital inspection, the catheter can then be carefully inserted into the bladder. Once the catheter enters the bladder, urine will begin to flow. The first few milliliters of urine are to be discarded and the actual urine sample is collected in a suitable container, such as a urine cup. At least 5 milliliters of urine should be collected for further examinations. The catheter is folded and cautiously removed. Next, the utilization of a Foley catheter will be demonstrated. If catheterization is being performed alone, then the catheter's packaging should be opened and prepared beforehand, in such a way that contamination is avoided and a sterile removal is possible. After this, wash and disinfect your hands hygienically and apply sterile gloves. The catheter can then be sterilely removed and enclosed completely in a hand to protect it from further contaminations. Despite the guiding wire, the flexibility of the Foley catheter can make its insertion more difficult than when using a rigid catheter. The catheter can then be inserted with a digital palpatory supervision. For this, the end of the catheter lies under and slightly caudal to the fingertip. Both index finger and catheter are together inserted into the vestibulum vaginae. Slight pressure on its floor aids in sliding the finger cranially until the papilla urethralis can be felt as a slit atop a small mucosa mound. The catheter tip is then inserted into the urinary meatus and can be pushed further with a finger until a flow of urine is achieved. If needed, the end of the Foley catheter can be fixated with a second hand to allow an easier insertion. The leading wire is then removed. The first few milliliters of urine are to be discarded, and the actual urine sample is collected in a suitable container, such as a urine cup. If the Foley catheter is to be used as an indwelling urinary catheter, then it should be blocked using an isotonic saline solution. The volume used to block the balloon can be read off the packaging. The catheter is then retracted into the bladder neck and fixated next to the vulva with a finger trap tie. The tube system can be fixated to the dog's flank using single sutures. A body is used to protect the tubes. With active dogs, the urine bag should be attached to the collar. With calm dogs, the urine bag can be left on the ground, the preferred placement, since this positions it lower than the bladder, allowing a better drainage of urine. The bag then only needs to be attached to the collar when going on walks. The Foley catheter must be unblocked before removal. Then, the catheter can be folded and removed in a steep caudoventral angle.